I'm going to give this one to you quick and dirty. These are the no muss, no fuss warning signs that you should be watching for postpartum. I'm going to give you 4 that you need to be calling 911 or going to the ER for, and then a few more that you need to see your provider for. Far too many of us are thinking that after we have a baby, everything's going to be fine and we don't really need to take care of ourselves that much. But the postpartum mortality rates in the United States point otherwise. So let's get going into the signs and symptoms. I actually have a full class called Postpartum Made Easy that you guys can grab down below where I go into these a little bit more. But I wanted to make this a quick and dirty going through those postpartum warning signs so that more people could get them, because any death that we can prevent through education is a huge win. So let's get started. Now, this is from the post-birth warning signs that comes out from AWON, which is my professional organization. These first 4 are ones that you are going to call 911 or go to your nearest emergency department. I know for a lot of you, calling 911 may not be your best option, but if you are in a place where 911 response times are better, that might be the best thing for you. The first one is pain in chest. That's right. Sometimes people end up having a heart attack after they have their baby. If you have a crushing pain in your chest, you need to call 911. The next one is obstructed breathing or shortness of breath. Now, you might have that after you climb the stairs, but if you are sitting still and all of a sudden you have a really hard time breathing, you need to call 911. It can be a blood clot in your lungs, and it's really important that we have that checked out. The next one is seizures. And you might be thinking, Hillary, I have no idea what a seizure looks like. It is generally shaking that you are not responsive during. Sometimes I see it just in the eyes. And again, they are not responsive while it is happening. Once it is done, a lot of times they are very, very tired. If it happens, you need to call 911. And the last one is thoughts of hurting yourself or others. Now, we can have some kind of crazy thoughts postpartum. I know I was always worried about dropping the baby, and we're not talking about those. We're talking about suicidal thoughts or thoughts of killing the baby. Those are something that you need to get help for right away. And remember, for these first 4, which spells out the word post, you need to call 911. For these next ones, it is something that you need to be seen by your provider pretty soon. They spell out birth. The first one is bleeding. Now, of course, you're all going to bleed postpartum, but there are some things that you need to get help for. If you are saturating a pad in an hour, or if you pass clots that are larger than an egg, I've also heard a golf ball, you need to go be seen by your provider right away. As a note, if you're postpartum and all of a sudden you notice your bleeding increase, but it's not in that range, it is a sign that you are doing too much and you need to do less. We expect far too much of ourselves postpartum, and I want you to be watching for this. I is for an incision that is not healing. Now, that can be a C-section incision, or it can be stitches on your perineum that are not healing well. If they are red and inflamed and getting worse, you need to see your provider. R is for a red or swollen leg that is painful to the touch. Usually it's in your calf area. This can be a blood clot and needs to be seen by your provider ASAP. T is for a temperature over 100.4 or higher. They've also talked about lower temperatures, but I think the higher temperatures is more. Ultimately, I think if you're starting to feel like you have a fever, because I feel like sometimes it doesn't show on the thermometer as fast, I would call your provider. As a side note, a lot of us get night sweats after we have the baby, and that's not really a sign of a fever. It's just your body letting go of a lot of extra fluid. So when in doubt, check that temperature. It's over 100.4, because that's right, in Phoenix, probably a lot of us are running pretty close to 100 in the summer either way. The last one is a headache that is not getting any better even when you take medication, or a headache with vision changes. And I think it's important to put a caveat on here. If you have the worst headache of your life, I would actually go straight to the emergency room. This can be a sign of postpartum preeclampsia and needs to be taken very seriously. Now, postpartum, you are likely going to have a headache now and then because you are not getting the sleep that you are used to. So it's important to see, will Tylenol, rest, water help the headache? If it's not, you need to be seen. Editor Hillary here to say that when you go to the ER, one of the first things you tell them beyond your symptoms is that you just had a baby X number of days ago, because that is a red flag to them. If somebody just comes in and says, I have a headache, it's very different than someone who's just had a baby and also has the worst headache of their life. So make sure that that is one of the first pieces of information that you tell people when you are seeking help for any of these problems. So those are the post-birth warning signs. I would actually recommend sharing this video with anyone that will be cocooning you during your pregnancy. So that's your partner, if your mom's gonna come, or a friend you know will be close by after you have your baby. Sometimes it's hard for mom to remember that these things are things they should be watching for, but when those people who love us see those signs, they can help us out as well. Now, my postpartum care made easy is actually included in the online prenatal class for couples, where I do a whole walkthrough of this, things that I see, things to be watching for. It goes a little bit more in depth. I'm going to put the link for that down below. Thanks for joining us here on the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and postpartum.